Good day. For today's video, I will be discussing the somatoform disorder. But first, what is somatoform disorder? Somatoform disorder pertains to people who have experienced imagined illness at some point. Soma means body. It is a pathological concern of individuals with appearance of functioning of their bodies when there is no identifiable medical condition causing the physical complaints. Overly preoccupied with health or body appearance, physical complaints without a medical condition, and focus on the following disorders such as hypochondria disorder, conversion disorder, and somatization disorder. First one will be hypochondria. This is the persistent idea that one is suffering from severe illness. Because this is a persistent and preoccupation idea, a hypochondriac does not get well. A person who diagnosed of having hypochondriasis is excessively and unduly worried about having a serious illness. Childhood trauma such as child abuse or neglect, extreme stress, childhood illness or serious illness in your family during childhood might trigger hypochondria. And one is the conversion disorder. This disorder seems to be a real physical or neurological defect. Conversion disorder is normally caused by some sort of extreme stress, emotional trauma, or depression. It is your body response to something you perceive as a threat. A disorder in which a person experiences blindness, paralysis, or other symptoms affecting the nervous system that cannot be explained solely by a physical illness or injury. Common examples of conversion symptoms include blindness, diplopia, dystonia, psychogenic non-epileptic seizure, unresponsiveness, hallucinations, and difficulty walking. It is the mental condition that cannot be explained by a medical evaluation. For the treatment, a person should undergo with a psychological therapy such as cognitive behavioral therapy and stress management training will be helpful to make symptoms more manageable. Somatization disorder. This relates the persistent complaints of symptoms to get attention. Somatization occurs through the mind-body connection. It can happen on its own. Emotions and stress may cause the physical symptoms. There is no presence of a real problem, but just the idea that one is sick that's causing the anxiety. Example of somatization disorder are pain or fatigue that causes emotional distress and problem functioning. Also, shortness of breathing and weakness. So we are done explaining the different kinds of disorder from somatoform disorder. So let's proceed on the dissociative disorder. It is a psychological dysfunction characterized by splitting apart of critical personality that generally are fused, permitting stress avoidance as a form of escape. There are three major kinds of dissociative behavior, such as multiple personality, psychogenic amnesia, and psychogenic fugue. The first one on the three major kinds of dissociative disorder is the multiple personality. This is a disorder wherein an individual plays two or more personalities. Those who are a multiple personalities have several set of eyeglasses because their visions changes with each personality. The problem here is because there is only one body, each body has to take turns, resulting to inconsistency, now known as dissociative identity disorder. The core personality is unaware of the other personality. Amnesia is another common symptom. As you can see on the given example, it is the true story of a woman possessed by 16 separate personalities. She is Sybil Isabel Dorset, that manifests 16 personalities, and also those selves have different names and personalities. Her multiple personality disorder results on the severe physical and sexual abuse she allegedly suffered at the hand of her mother, Haiti. The second from the three major kinds of dissociative behavior is the psychogenic amnesia. Psychogenic amnesia. This disorder refers to the inability to remember past experiences, although the forgotten material is still there in the memory, only it cannot be recalled. It occurs when a person blocks out certain information, often associated with a stressful or traumatic event. It is characterized by a sudden loss of autobiographical memories for the whole of a person's past and leaving a person unable to remember important information. Psychogenic fugue. This also refers to a kind of amnesia where there is a loss of identity. Individuals forget who they are and the state is accomplished by escape or flight from home environment. This amnesia take an impulse, a sudden trip or assuming a new identity. Also, it is a rare psychiatric disorder characterized by reversible amnesia for personal identity, including the memories, personality, and other identifying characteristics of individuality. They often become confused about who they are and might even create new identities. Example of a person has a psychogenic fugue is traveling away from home. Psychogenic fugue is caused by a situation that gives the person extreme emotional distress. A common cause of it is severe sexual trauma of some sort. Traumatic events such as wars, abuse, accidents, disasters, and extreme violence.